One of the most common injuries to the knee is the ACL tear. Now that is the tissue that connects the thigh bone to the shin bone at the knee. What can be done about it? Well, Dr. Kristyn Darmafall from Orthopaedic Specialists is here to tell us about the options, and there's some kind of new ones. You guys are developing new techniques and such to help us?
Yeah, so we're continuously trying to improve ACL surgery, reconstruction, and then the outcomes. And one of the areas that we're looking at is what do we use to reconstruct your torn ACL? And so in general, we try to use your own tissue, including tendons, and we've traditionally used your patellar tendon or your hamstring tendons, but more recently we started using part of your quadricep tendon because it's a really good graft, and that's been able to reproduce really good results in getting patients their best outcome for getting back to their activities and life.
That's neat. So you can tear this tendon. It's a tendon.
It's a ligament.
A ligament. This can happen just falling, tripping, walking your dog. You don't have to be an athlete.
Correct. So there's actually 70% of ACL injuries are non-contact. And so typically what happens is when you're either landing or you're stepping down and your knee kind of collapses in or across the front of you, that's the mechanism to tear an ACL.
Oh, got it. I bet it's very painful. Show us what we're looking at here, doctor. This is hard for us to discern, but explain that.
So we're looking at a side view of an MRI of a knee, and the top two pictures are actually what a normal ACL looks like in the middle of the knee. So you'll see straight, it's kind of like a straight black line going from the left side to the bottom to the right side top. And then the view underneath that is actually what a torn ACL looks like. So the patient has a complete tear of their ACL, and you no longer see those straight line fibers going across the notch.
In the old days when that would happen, were people just disabled the rest of their lives? I mean, what was the fix?
So multiple years ago, if you were unable to have it reconstructed, you actually can compensate for not having an ACL, but it does put you at risk of having instability events which lead to wear and tear or arthritic changes. And we know it happens a lot faster if you don't have an ACL.
Okay. I just want to explain that this is not a knee replacement.
Nope.
This is to repair that.
So we're using tissue to reconstruct it.
Got it. Okay.
We actually are looking at repairing ACLs. We've done this years ago and they didn't do very well, but with new techniques and certain kind of synthetic wraps, we're actually finding ways to potentially be able to repair them. That's probably a few years away, but making progress.
So explain what this is, doctor.
So this is actually one of the grafts that we use. So this is a hamstring tendon, and on the left is a schematic of what it looks like artistically, and then on the right is actually what it looks like when we put it into the joint. So that's the hamstring where you can see that there's a couple different limbs of it folded over, and that can be used for your ACL.
How many years have you been doing these?
Oh, so over a decade for actually doing ACLs.
And it's is there always a good outcome? I mean, people are, they're happy and they're active again.
So in general, you have a really good outcome. We know that, and what we're working on is making sure we get better outcomes. So if it's an athlete who wants to get back, we want to make sure you can get back to the level you were prior. And we're improving this with both our surgical techniques, using these different grafts and getting better outcomes or less re-tears or other side ACL tears. Between the surgical and then the rehab and the recovery, we've been able to improve outcomes for patients.
And so this is another graft. Explain
so this is the quad tendon graft that we've, in the last few years, really started to see provide really good results with less of the donor site, or when we take your patellar tendon, you can sometimes end up with knee pain in the front long term. But when we use your quad tendon, we're getting the same long-term results of the reconstruction without having that pain.
That's the latest and greatest right there, huh?
Yep.
Wow, have you done several of those
Yes.
in the Quad Cities?
Yes, my patients have done fantastic too.
That is so great. That must be very satisfying for you to see how you're able to progress these surgeries and get better outcomes for patients.
Absolutely. My favorite thing to do is to be able to go and see a young athlete when they return to their sport and get to go watch them participate in it again.
Wow, I love that. So this summer, have you seen a lot of this? I mean, does it seem to go seasonally or not necessarily?
We definitely have fluctuations depending on what sports season it is.
Okay.
So we know that football and soccer, volleyball, lacrosse, and basketball have really high levels of these injuries because of the quick cutting mechanism where they're doing that quick turnaround.
Yeah.
And they can have that knee motion that causes the tear.
Okay. And then in the winter, people are just falling in the ice, walking their dogs.
It can happen.
Yeah, it can happen. Okay, so Dr. Kristyn Darmafall is here from Orthopaedic Specialists. And so that's where you could go in the Quad Cities. Look online there. They have a great team of docs. They do all different kinds of things to fix up all your aches and pains and breaks and all those things that happen to the human body. And it's pretty amazing to hear what can be done and what we could do here in the Quad Cities too. That's very rewarding for all of us to hear. Thank you, Dr. Darmafall. Good seeing you today.
Thank you.
Good job.